Hello and welcome. I'm Sonia Johnson, Director of the Policy Research Unit. Well done for being the people who got here right at the start. It's great to see you. Sorry, we haven't quite come up with the promised sunshine as it appears on the invitation, but maybe in time for drinks on the rooftop later on, if that's what we're doing. So I'm just going to say a small amount about the Policy Research Unit. Some of you know all about it, I think, and others maybe a bit less. So the current Mental Health Policy Research Unit was funded by the NIHR on behalf of the Department of Health and Social Care in 2017 as a collaboration primarily between UCL and King's, but with a wide network of collaborators around the country. And it was the first wave of a series of commissioned, well, I think the second wave of a series of policy research units commissioned by the Department of Health and Social Care and partners. There was a neonatal one that had been around for ages, and I think one or two others. But the model definitely seems to be a favoured one currently. As luck would have it, the announcement of the next wave of policy research units is actually tomorrow. So tomorrow you'll be able to find out, if you don't know already, whether we have been funded for another 5 years. Today, I'm afraid you just have to guess if you don't know, as the information is embargoed at the moment. And I must say, when we first got funded, I thought it all sounded interesting and practically useful, but I actually had a fairly dim idea of what it was actually going to be like and what the expectations for policy research were actually going to be. I was also a bit on edge because I slightly wondered whether we were going to have to grapple with impatient politicians who are on their way to Prime Minister's question time. In fact, it's turned out perhaps more straightforward than I feared. We've only seen one politician in just over 6 years, which was a Tory minister who arrived for, I think, about 5 minutes, an hour late on our launch event day. And maybe don't tweet this, but we needed to stop and have him say his greeting and then continue. And actually, we haven't really met any politicians otherwise since then. But we have worked with a lot of people, officials in the Department of Health and Social Care, in NHS England, in OHID, and in other government bodies. And one thing actually that has been striking is that they have all largely seemed quite genuinely interested in what research might contribute to policy. So I wondered whether we might spend a lot of time trying to persuade people that it was any use doing any research anyway. But that didn't really seem to be the case. I think largely we found that people were interested very much in principle in what research could bring to policy making, but with the big constraints that it needed to be on time to actually make some practical use of insights from research, and also somehow actionable, so not so much the perennial more research is needed. So we've done a series of research studies, and the later ones we're going to talk to you about today, but there are just a few notable things about how it's all been, a few things that have struck me. One is that it has encompassed an extraordinarily large range of topics, from social media use in young people to community sentencing of offenders to all the topics we're going to talk about with you today. 3 notable things that we've spent a lot of time but aren't going to talk about today are the independent review of the Mental Health Act, support for people with complex emotional needs who may have a personality disorder diagnosis, and finally the response to COVID, which, as it turned out, took up a considerable amount of our time in the first policy research unit. So those are some things that are striking about the diversity of it, and the need to be responsive throughout has been quite striking. Other things that have been striking are the seriously good research staff whom it's attracted, as you'll see today. We've had an excellent team, and those who've left have gone on generally to do quite impressive things related to research and to policy. The lived experience working group and the lived experience leadership has been another remarkable feature of our experience in the first policy research unit. We recruited a group of people with relevant lived experience to work with us at the beginning. Quite a few of them are still with us now, more than 6 years later. And it's been amazing to watch their roles and their skills develop across the PRU. So you'll see various developments. Today we're showcasing the lived experience commentaries, which have become an innovative feature of all our papers and which we're starting to see adopted by other research groups today. And they've made increasingly wide contributions to our work, from development of research questions through participating in things like systematic reviewing and qualitative interviewing, to contributing to final write-ups and sometimes leading them. They're a challenging and creative group of people who've been great colleagues over the last few years of the Policy Research Unit. And the final thing to note is the very wide range of collaborations that we've had through the PRU. People, researchers, experts, all sorts of people around the country have been remarkably willing to contribute their expertise to specific projects. It's been slightly terrifying in that we've often known as a team very little about things that we're asked to investigate, and the happy discovery is that the people who do know a great deal have been willing to work with us, advise us, contribute to papers. So those of you who are here or listening online, thank you very much for that. That's been a remarkable thing, the extent of the help that we've had from all sorts of people. So far, it's been a great experience, really, the whole policy research unit, and one that we hope that has contributed to mental health policy in England and potentially elsewhere, although, of course, there are many forces in play at how mental health policy actually gets made, and even more barriers to implementing things that sound as if they would be good. But we hope that we've made contributions that, if they don't have an immediate impact, may at least have some effect somewhere down the line. So I'm going to hand over to Alan Simpson, co-director of the PRU from King's, who's going to introduce you to today's proceedings.
Thank you, Sonia. Good morning, everybody. Lovely to see you all. Really fantastic to be here. Sonia mentioned about all the work we did looking at the impact of COVID on mental health services, but of course COVID also impacted us as a team, and most of our work over the last 2 or so years has been done remotely, and so it's really nice to meet people face to face today, and for some of us, meeting people we've worked with but seeing them for the first time, so that's a really nice part of this. It's a really exciting day. Sonia's given a highlight of some of the things that we've focused on over several years. Today we're presenting stuff which has been largely undertaken in the last year. So you can find sessions looking at how do we improve mental health care for autistic people, how do we look at alternatives to acute care mental health provision, and we've also got some fantastic sessions looking at the delivery and the receipt of peer support interventions. We've also in the afternoon got sessions on shaping policy through different research, and so we've got a range of different research projects there, which will be, you can look at and engage with how we are trying to influence policy across a range of areas. We've got interesting work around the Every Mind Matters campaign, which is a public health campaign, where Claire Henderson has been leading a team of researchers evaluating that. And most particularly, we have a really fascinating workshop, interactive workshop, on taking co-production seriously. So we do a lot of lived experience involvement in our projects and increasingly moving towards co-production as often as we can in our research projects. And some of our colleagues will be discussing that and exploring that, and we invite you to join them for that. Just along the corridor here, Sonia mentioned the poster displays. There's some nice posters there of some of the lived experience commentaries which have been published alongside papers. Do have a look at those. If you're nifty using QR codes, do click on the QR codes and you can get immediate access to the actual original papers and the lived experience commentary. There's also some chairs in there if you want a bit of a quiet space and a sit down. There's toilets on this floor, so make yourself available with those. There's drinks and snacks just outside there, and we'll be having a series of presentations for each session. Then we'll have a short quarter-hour break, and then we'll have a panel discussion to explore in more detail some of the issues being explored in those topics. So I'm not going to waste your time now. I'm going to encourage you to go to the next session. So if you're interested in sitting in on the mental health care for autistic people, please stay here. If you wish to go to the acute care presentations, it's up on the first floor in the council room. And if you're interested in attending the peer support presentations, it's in the river room, also on the first floor. Hope you enjoy the day. Thank you very, very much for coming, and we'll see you during the day. Thank you.